Let us discuss about fetal circulation. During the fetal life, the placenta serves as the major organ for the exchange of gases. The oxygenated blood from the placenta enters the fetus via the umbilical vein. From the umbilical vein, the oxygenated blood, which is about 80% saturated with oxygen, enters the liver. And from the liver, it enters the inferior vena cava directly through the ductus venosus. Some amount of blood from the umbilical vein enters the hepatic sinusoids where it gets mixed with the deoxygenated blood from the portal vein. The oxygenated blood in the inferior vena cava also receives some amount of deoxygenated blood from the lower extremities, pelvis, and the kidney. The blood in the inferior vena cava enters the right atrium. From the right atrium, the blood enters the left atrium directly via the foramen ovale. In the left atrium, it also receives some deoxygenated blood from the lungs. The blood then enters the left ventricle, and from the left ventricle, it enters the aorta. In the right atrium, the deoxygenated blood from the head, upper extremities, and neck is brought by the superior vena cava. The deoxygenated blood then enters the right ventricle, and from the right ventricle, it enters the pulmonary artery. During the fetal life, the resistance in the pulmonary vessels are high. Therefore, the blood, instead of going to the lungs, enters the aorta through the ductus arteriosus. In the aorta, there is a mixing of both oxygenated and the deoxygenated blood, and the saturation of oxygen drops to 50% by the time it comes towards the umbilical arteries. The umbilical arteries carry the deoxygenated blood back to the placenta for diffusion of gases. After the birth, there are some changes that take place in the fetal circulation. The ductus arteriosus closes due to the contraction of the muscular wall. The blood from the pulmonary artery then enters the lungs. The lungs become the main organ of respiration. The exchange of gases takes place here, and the oxygenated blood enters the left atrium via the pulmonary veins. This increases the pressure in the left atrium. Simultaneously, there's a decrease in the pressure in the right atrium due to the cessation of the placental blood flow. This difference in the pressure causes the closure of the foramen ovale. There is also obliteration of the umbilical vein that later develops into ligamentum teres. The ductus venosus becomes ligamentum venosum, and the umbilical arteries obliterate, and the distal part of the umbilical arteries develop into medial ligaments, and the proximal parts develop into superior vesical arteries. So these are the changes that takes place after the fetal birth. The ductus arteriosus becomes the ligamentum arteriosum, the foramen ovale closes, the umbilical vein develops into the ligamentum teres, and the umbilical arteries develop into medial umbilical ligament and the superior vesical artery.